Okay, welcome then to this session on supporting systematic reviews. This is part 2 as we look at managing our search results on the new EBSCOhost interface. So this 60-minute session will essentially introduce options for managing search results after searching literature on CINAHL and MEDLINE. So it could be either database in support of systematic reviews. So we'll look primarily at the matter of storing, retrieving searches, references, exporting to bibliographic software, such as Endnote and RefWorks. So for those who may not have joined the first part, I'm Richard Crooks. I work for the EBSCO Customer Training Services team. I'm a senior customer training specialist supporting librarians primarily and users in the UK, Ireland, and Nordics via trainings, etc. I'm a chartered librarian now with EBSCO for about 14 years, previously working as a medical librarian. So for those who were in part 1, welcome back to the webinar as we look at concluding this short series. So in terms of what I plan to cover, I hope that by the end of the session, you'll be able to save, download, and share search results in the new interface. Some of you may be accessing it already, others are still awaiting migration, but at least you'll get a foretaste of what you need to do with this new platform. You'll be able to export results in RIS and other related formats into bibliographic software, again, the likes of Endnote, RefWorks, and so on. You'll be able to save searches for future reference and also be able to create projects and add searches and results to those projects. So projects are simply the custom folder area that is now available within the new interface. And you'll be able to find further support for managing searches and results on EBSCOhost via the EBSCO Connect support portal and other channels as well. So I hope that's what you're expecting from this session. We are looking at managing search results. We're not going to be running searches today. I've already run one, as you'll see in a moment, and we'll go from there when we go to the live demonstration. But before I do that, I just want to outline some of the key features of the new interface in case many of you may not have seen this as yet, but just to highlight some of the key elements which we'll look at live as well. So in terms of having your results available, once you've got the results available, you can select records. At present, you can select up to 50 records per page. There is an enhancement for this, so this is likely to change. It's likely to increase in the coming weeks, months. So that figure will grow from 50 currently. So, but you can select 50 per page and add them to the save folder. So by default, when you save records in the interface, it's saved to the save folder within the My Dashboard area, which is on the left-hand column of this screenshot. So again, you can select the option there. You can, of course, select individual records if necessary. Otherwise, from the drop-down, you can select 1 to 50. You can use the bookmark icon, by the way, as highlighted there to save records. Now, when you save records, as I said, it does go to the saved folder area within the My Dashboard. And a key thing to point out here, so that's saved there on the left-hand column, is that you would need to be signed into a My EBSCO personal account if you want to save these records beyond the session. So obviously you can still view the records, you can still download them, share them, etc. But if you're going to come out of EBSCOhost, the platform, and you want to go back into it, then in order to see those records, you'll need to be signed in as a My EBSCO user. Okay, so we'll say more about that in a moment. So again, there's the option, there's a prompt when you go to the save folder to save your progress to sign into the folder. So again, if you're not signed in already, then it reminds you. If you work in the NHS in England, then EBSCO single sign-on means that you are already signed into a personal folder. But maybe for most on this in this session this morning, you may need to sign in or create an account. Okay, so again, we have instructions on that, and I'll go through that as we go through the live demonstration shortly. So you can also download the results in a variety of formats. Just click the appropriate option, select, and then the download option, as you see highlighted, and that will open up another box, and it gives you the option to download the metadata, so the bibliographic content for records in PDF, Word, CSV format, as well as others as well, including BibText. I know some in the academic community use BibText. So again, there are numerous options that you can use for downloading the list of results or selected results as appropriate on the interface. Again, we'll look at that live shortly. In terms of selecting records to share, so if you want to share via Google Drive or OneDrive, then again, you can choose the corresponding icon that you see highlighted there, and that will open up another dialog box, and then you can select Google Drive or OneDrive from that menu as appropriate. You also have the email option as well. So if you select that, you can simply enter your email and then forward records. Now, if those records have full text, they would be included as attached files as well. So if you have online full text or PDF attachment or a full text article available, then those formats, either one or both, will be forwarded in the email as well. So if you are looking up information, if you just want to send a series of articles to a user, maybe someone you're supporting with an event search, then you can also forward the full text there as well. Okay, and you can send it accordingly. In terms of exporting, as has always been the case with the classic interface, we support the exporting of up to 25,000 records per session from the result list. And you can see here we've got the option to select again the records on the result list and then choose from the drop-down menu to export results up to 25,000. Of course, it could be along this lines. It could be just over 680 records. It could be 500. It could be 5,000. It doesn't have to be up to that upper limit, as it were. Now, in a 24-hour period, you can export up to 100,000 records. So 25,000 is the limit per session, as it were. Okay, but in a 24-hour period, you may ultimately upload a lot more records. But in one sitting, you can upload up to 25,000 records directly from the result list. You can also export from the tools menu adjacent to each record as well, if you wish. So you can support individual citations, as it were, and select the appropriate format for that, which you see there. Now, in terms of the search history itself, you can see the screenshot here. Then you can download the search itself. The search can be downloaded in a variety of formats, including PDF, Word, as well as CSV. So if you want a spreadsheet or a table of the search, you can use the CSV format as well. So again, the search history can be hidden. By the way, it may be hidden. You can open it up, and then you can choose the download option, and up to 500 lines can be downloaded at one time. So that would be 500 sets essentially. And then you can choose the appropriate format: PDF, Word, CSV, again, RTF. RTF typically is, at the moment, probably the preferred format in terms of a text format, because the search sets they're not appearing just one page at a time. They're appearing together, as it were. Okay. Again, we'll see an example of that live in a moment. Okay, so again, you select the format that's most appropriate to download that search. Okay, from there. So that's just a brief introduction, a review of what you can do with the managing the results. So we'll go and see that live now. I have included some links to documentation, by the way, support information, which covers some of the details of this. So I know some may be making notes or even following online as well. That's fine. But we will now go to the live demonstration. And in a moment, you should see CINAHL opened, and you'll see I have a search history already displayed on screen. So that is based on the search we ran in the first session, part 1, in relation to adult cancer patients with fatigue where meditation, yoga, etc. has been used to and see what the impact is on quality of life and so on. So I've got the result sets here in my search history. As I mentioned, it can be collapsed here, so you might see the results page in this fashion. Otherwise, so if you want to focus on the search results themselves, which we'll do for the time being before we save our search. So we've got the search hidden in the background there. We'll come back to that in a moment. But initially, if we look at these records, I've applied a filter already for this, so I'm not going to do any more refining with these search results. I've got them here, so I want to process them. Of course, I can look at individual records. I can go into this article, for example, and just click on that title, and I can view this, etc. You can see we've got references also listed for this record as well, so you can view other content here. And notice for each of these records, there's the bookmark icon, so I can save these individual records like so, etc. I can go back to my result list. I can also save that record, so I use the bookmark icon adjacent to each of those records as well. And I can also select the entire list, or I can change the view from 10 to 50 per page. And then I can save that initial 50. So as I mentioned in the PowerPoint, so select and choose from the drop down 1 to 50. Okay, so once I save these records, then they're being saved to the save folder under my dashboard on the left-hand column. So if you just click on that link there, you'll see we now have the records shown here. Although I'm not sure why I'm only seeing 54 at the moment, so that must be a bug at this stage. So I'll maybe just review that in a moment. But you'll notice here it does say, as we saw in the PowerPoint, you're prompted to sign in to save your progress. So basically that means you need to either create a EBSCO account or you sign in here. So if you don't have a EBSCO personal account, if you're a user, a student, if you're a nurse, a clinician, then you can create an account here and then you fill in this form. So notice we support Google sign in, by the way. All you need to do is add your first name, last name is optional, email address, you create the password, noting the criteria below, and then you do need to agree to the consent form so that EBSCO will collect specific data. And any concerns about what EBSCO collects, there is the EBSCO's privacy policy link there as well for more information on that. But you do need to agree to the consent form for us to collect that information, and you can then begin using your EBSCO account. So for that, you can just obviously create the account, and then also once you've done that, you can click sign in here. So I can sign in here, and hopefully my VPN is still active. Otherwise I have to sign into that as well from my end. And then once you do that, you'll notice in a moment I've got a lot of other records that are saved here. Okay, so from other searches as well. So again, that's collating them in the save folder. And I'll say more about processing results from the save folder, especially if you want to differentiate what you say before with current searches in a custom level, as it were. So that's the initial saving of records. Now, likewise, you can save the search in that fashion. So we just go back to our search screen here. So I'm just going back to the search results here on this screen. Okay. And again, we got a search history that we can view. Okay, so I'm going to just open that up here. Okay, so I'm going to resort this again. So that's saving the initial records, you know, even though a page results, as it were. But I might want to save the search itself. Now I've got the search here, but there is an option above the result list, the tools here, to save the search directly here. So click Save Search here. Now what it defaults to is the last string, as it were. So it combines all the subqueries, all the queries there, and then you're left with the result set, which is in this case 182 records. You can also copy that to the clipboard. So you see the complete search, the combination of terms grouped together there. So what I'll do here, I'll just change this. So I'll give it a proper search name. So for example, adult cancer patients and meditation. Okay. So I have a description. I know in previous sessions we've been asked, can you add comments to the search that you save? Yes, you can, because you've got the description field here. It's optional. So I can add something here, whatever it might be. It could be in terms of the due date, or I might just say this is an ongoing evidence search for oncology, whatever it might be. Okay. I'll just put that in for now. So you can add comments, information there about it. And then once you've done that, you can make sure if you scroll to the bottom of the page, you would save this. Okay, now it says it's been saved. You can manage your saved searches from the save page within My Dashboard. So if I click Close, and I go to the My Dashboard column and click Saved, you'll see the save records initially. But now if we go to Searches, you'll see I have numerous searches that are saved here. So I've got this one, adult cancer patients and meditation. You see I've done this one before as well, but I can go in, yeah, so I can, look at that if I need to refer back to that. But I've got the search here. Okay, so I've got my records and searches saved into the save folder. Okay, so now if I go back a step as well, we'll look at sharing information also. So I go back to the search, and we'll look at that. Again, we've got the search history open. So as well as saving the records, again using the bookmark tools here, I probably didn't do this. You can save from there. You can also share records as well. So that can be done again collectively. So for example, I can select these and I can share. I can actually download. Let's download first. Download this list. And again, you can see the formats that are available. So you've got PDF, Word, etc. So if I choose Word here, I can click download. and then I could save that file. As it prepares the file, I'll then save it. Okay, save it to my drive, and now I can access that. Now what I'll do, I'll just drag this across my other monitor, and you should see the, okay, so let me just make this a bit smaller. Okay, so I just drag this across, you'll see the output, which is this Word document. So with the listing of contents, these 50 records, and then you have on the subsequent pages, you'll see we've got, let's see if we can, yeah, we can see in a moment the records that are saved. Okay, so you can see it, and it includes the link as well, the link to the record as well. So that's the Word format for saving. We won't explore those, but again, you've got CSV, you've got BibTeX there, marked 21 as well. So you can download from that list. That's the metadata. And then you've also got, we'll come back to projects in a moment, you've got this icon here to share. So you can share also, as I mentioned in the PowerPoint, Google Drive or OneDrive, and you can also use the email option. So I'm going to send these results to the person that you're supporting, maybe this review that you're supporting, it's a team or it could be individuals, then you can just enter the email address and forward, send what you found already. Okay, and you get confirmation that's been sent. So that's the email option. You can also do the same, and you can cite, by the way, there is a cite tool here. So if you want to copy the citation and export it from this menu, you can. You can see here we've got the Harvard reference style selected. That can be changed by default depending on what's preferred where you are. So if you're working with APA databases, you may want APA 7th edition. Other sectors may have Vancouver, Chicago, etc. But that's something which can be centrally managed in our admin tool. Okay, but you still have the option to change that if you wish. Okay, whatever is appropriate. You can copy the reference, the citation to the clipboard if preferred. Always you've got export citation here as well. So again, this is where you can export an article or articles in RIS format here. So for RefWorks, Mendeley, Endnote, etc., or Endnote Online, Endnote Web, as it says there, RefWorks is also there as well. So again, there's some tools there to use. That's the cite tool. Now you can also do the same for individual records as well. So you can use the tools menu. You can see the cite tool is there. The share option is also there as well. Okay, and with the individual record, you can create a link to this as well and copy that to the clipboard, and you have the email option also available. Okay, we just got one more here, and share. And this time, because we've got, let me just show you this, because we've got these access options, this is the PDF online full text, so this is the full text article, it's available. If you want to send those files, you can go to Tools, Share, and Email, and you'll see the PDF and online full text will be included as well. Okay, so those tools. So there are numerous ways to save or share out items individually. So again, if you go back to a record here, for example, you'll see the same tools are available. The cite tool, add to project, I'll come back to in a moment, share, and then the download option. So you can download individual records. You can download the full text where that's available in PDF online full text, if either or both are available, and then the metadata only as well. Okay, now of course, in the context of supporting a systematic review, it's quite likely that you're going to be working with a large number of results. You're not going to necessarily send or share individual records, etc. You're working with a result list, etc. Okay, so you can export the list, as I mentioned, and we show that in the PowerPoint. So we've got 182 records here. So we can select this and choose the export option here up to 25,000. So if you click that link, now it will prompt you to sign into my EBSCO. If you've not signed in previously, it will, like the save folder, prompt you to sign in. And again, you can see the reference to, exporting up to 25,000 records at one time with an upper limit of 100,000 in a 24-hour period. Okay, so obviously you need to select email addresses. You can add others here, and then you choose the preferred format, which perhaps in most cases will be RIS format, it could be BibText, and you have the CSV option as well, along with XML. And then once you've confirmed what format you prefer or the recipient prefers, you click send. And then on screen, you'll get confirmation that a link to download metadata for your results will arrive in your inbox shortly. So you'll receive the bibliographic records information related to those 182 references in this case, and then you have 7 days to access that link. So basically, you'll send us a link to your inbox. You click on that link and you can extract those records and import into your preferred software. So it could be Endnote, it could be RefWorks, for example. Okay, and again, it can be as low as 182, it could be 25,000. So the export option is available there as well. Okay, so now in terms of the actual downloading of the actual history itself again, we'll come back to the results in terms of setting up project folders, etc. But you've got the results here. Okay, so the search history is displayed, and if you select these sets, you have the download option there, the icon there, and select that. And it gives you the option to choose the format. So again, you've got PDF, you've got Word, you've got CSV, if people prefer that, XML, RTF, and text as well. So I'm going to save in RTF, partly because at the moment, when you view the file, each set number with Word, for example, is on one page at a time. Now, that's okay, you can edit it later, but with RTF, it tends to group sets together on one page. So it could be set 1 to 3 is on one page, for example, and we'll see that. So I'm just going to download this search history now. Okay, and we'll click save. And again, I'll do the same thing. I'm going to open this up and I'll drag this from and actually it's going to open in this window this time. So you can see here, this is the downloaded search history, and you can see the set number clearly designated. You've got the query, so the actual query. Okay. And then you'll notice as you go through, it shows the expanded query as well. It gives you the date stamp, the hit count, the search mode applied if applicable, so proximity, the expander, apply current subjects. We covered some of that in the previous session. Obviously, we're using the EBSCOhost interface, and we're looking at CINAHL in this case. So obviously, it would be MEDLINE if you're on MEDLINE. So again, you go through this, and you can see it groups about 4 sets per page. Okay. So again, you see the expanded, you see, for example, the S2 or S1, but below that you actually have the terms, the actual expanded query as well. So again, any comments or feedback on any of this will be useful for us. There are additional features or changes coming to the interface. As you're probably aware, we are developing this interface, and we do have documentation to clarify what's been done and what is coming soon as well. But this is just RTF in terms of the download of this search history, rich text format. Again, others are available there as well. Okay, so I'm just going to close this as well. So again, this is the download option for the search history. Now, with the search history, it is also recorded under recent activity as well. So if I go to recent activity under my dashboard, you'll see that's also listed here. Okay. And you can sort it so it's shown in sequence with the oldest option there. So again, you see the search strings, the first title abstract search related to cancer, the CINAHL heading search related to neoplasms, cancer fatigue, etc. Combine those two terms, then fatigue combined again, and then you see the intervention for the PICO or PICOT meditation, etc. The combination of title abstract searching XB, MH, indicating these are CINAHL headings combined, etc. And then you can view the set there of results, okay, with 182. And for each of these sets, you'll see each of the options is highlighted. So the proximity search mode, apply group subjects, and then you've got below that, I've also added the filter for all adults as well. So it does designate those things, those areas or those filters, etc. options that have been applied as well. Okay. Now it is possible to go in again. You can even download this as well. Again, the same format's presented, so you can download from this screen, and you can also delete from here as well. Okay. Now another thing you can do, and we will do, is create a project. So a project is basically your custom folder. So essentially, as we've seen, if you go to saved, you'll see everything saved there, search, records that you saved in one folder, essentially. Now, if you're using that folder over time, you will build up a lot of references, as I have, plus multiple searches. But you may want to create a project in relation to a particular search where you'll collate the searches and the records together. So saved is by default. Projects is under my dashboard, and you can see I have some projects already listed here as well, and I can go in and delete some of these. I probably won't keep them all. So this one, for example, I can go in and delete this. Okay, I can go in and edit a project. For example, I can change the name. I can set a due date. Again, I can add comments here under description if I need to. And of course, I can also create a new project. So when I create a new project initially, I can go to the plus sign. And then this time, as you might guess, it's going to be adult, cancer patients, and meditation. Of course, there is a character limit for this as well. As you can see, it's 255 there. Due date, so I could be working on this. I may have a particular deadline. Again, in the context of a systematic review, there will be a deadline for the completion of the search strategy, etc. So again, we may give ourselves maybe till, I don't know, let's go to the 1st of February, for example. Oh, it's a Sunday, so let's go for Monday 2nd. And then I can give it a description. It could be who it's for, the department, etc. More information, but I create that for now. So at the moment, I have this project. I can click through to it. It shows me the due date, but I've got no records or searches here. So what I can do, I can either go, so for example, I can go to recent activity here, and I can select, and I can add this to the project. So I can choose that project here and add now. Okay. So if I go back to my project and go to adult cancer patients and meditation, we now see I have the search here. Okay, so it's available. Now, it may be that rather than using the search history from recent activity, you may want to go in and save the search history from the main results page. So what I might do here, just select this, and I can delete from here as well, by the way. So I've still got my project. Okay, it's still there. And I'll go back to the search history. Okay. And that's sort of adding articles as well from the result list. Okay, so that is, with the search history in view. Okay, and I can go in. So for example, if I go back to save search here, no, I think I can't do it here. Sorry, I thought I could do that here. I think it's actually, if I save it, so what I meant to do is this. If I come out of this, if I'm in save search, so you can download, at the moment, you can download the search from this menu as we saw under search history and save the document there. In save search, we should still have the search here, hopefully. Yeah, so this one, I can add this, I can select this one, and I can add that to the project. So again, if I've run the search, saved it, then I can go in and add this to the project here as well. So again, it's recorded in two places. Okay, and then if I go to the projects, I'm not sure. Let's see if it's listed twice. Probably should be. No, it's not. Actually, it's interesting. Maybe because I've already saved it. Let me just come back here and searches, select, add to project. It may be because I've already saved it. I've not tried this before. Yeah. So as you see, I don't need to do it because it's already saved. Okay. So I saved it from the recent activity to a project. And even though I go into the save folder and seek to add it to this one, it knows that that's already been saved. So that's fine. So I can actually, I can leave that as it is right now. I can go in. You can see the search details here, by the way, as well. So essentially then, my project's there. If I go in and rerun the search or look at the search, so just to save time, I'm just going to go to recent activity, look at this set here, rerun this. Okay, and just rerun it from the recent activity page this time. So just so I can save those results. So I've got my results here. So what I can do is then I can select these results here, so any particular time, and I can add them to the project here directly from this list. So it's possible that you might want to sign in to EBSCO because you need to be signed in to EBSCO to create the project. Once you create the project, you can, actually save your results directly to it. So you can bypass the save folder and go straight to the project you created. I'll add those now. Okay. So you can do it in that fashion. And again, it applies individually as well. You can do the same for individual records here, add to project for each one as well. And likewise, if you go into an article, click through to it, you can also add to the project there. Now, if it's already saved there, which it probably is now, you should know it should note that. Yeah, so you're not going to duplicate it. It does recognize that that's already been saved. Okay, so again, and if we go back to projects now, and this project again, you'll see now we've got those records stored there. And this is a good place because at this stage, you can then obviously review some of the articles here, and you can delete them individually if you wish to. For example, I'm going to choose some at random here. I can go into these ones. Okay, just say these items, and I can delete them. Okay, from here. So it means that you can, if you save directly from the result list to the project folder, then you can screen them, you can better review them in your own time and delete others that may not be appropriate or may not be relevant to your search query, as it were. Okay, so again, you've got the options there. So you can also export from here as well. So you can choose the appropriate format here, and then you save the RS file. Okay, so you can do that from here as well. So it may be that when you're running the search in support of review, once you've got your search history up there, you may want to just, make use of the time there. You can, again, create the project. You can download the search history, which we saw earlier. You can download that from this menu. Again, select it, and then you can download from there. And in terms of the actual references you've seen, you can select them from here, and then you can add them directly to a project, or you can simply just export them from here as well. So again, you don't have to use the save folder. It's kind of like an initial step, but you can actually, just create the project and then save directly to the project, especially if you have numerous searches that you're working on and you want to be able to identify them clearly and who they're for. Okay. Also, if we just go back again, if there's any questions or comments about any of this, please do follow them in the Teams chat. We are well ahead of time, so it's hard to gauge sometimes how much time it will take on these sessions. But this one is mainly, obviously, we're looking at managing search results rather than searching specifically. But we have got, let's see now. If we go to the projects again, and we'll just edit this one, so you can edit this one. Go to edit project. And then this time I will say this must be completed or reviewed with, let's say, Dr. Smith or Professor Smith. Let's go for Professor this time, male or female. So click Save. Okay, and I think if we click through to it. So what I wanted to show you that when you add comments in the description field, those will appear in the placard above. Okay, so you've got the title of the project, any notes that you've made, so it could be in relation to a department, a person, or just simple comments about the search. The due date is given, and then you have the records below and the search is there. And of course, with all of this, again, the search is there. You can delete the search if you need to. You go in, check the search details, delete it individually. You can go and delete records in this list, etc., download them, and so on. So again, a lot of the functionality that you need is available within the project folder itself. And at some point, if this project is completed, no longer required, or being superseded, then you can go in and delete the entire project here as well. Okay, so again, projects are simply a way of differentiating between different searches, topics you're working on in support of different personnel, maybe different due dates as well. So again, combining the records that you saved plus the search, and that may be to keep it there until you've had time to process them. Otherwise, when you are in the result list, you can obviously download items you can export directly from the result list as well. And that, of course, the download includes the search history itself as well. Okay. Now, one thing I will show that I didn't show in the previous session, which I probably will need to for the next session we run, and I've just seen a question from Michelle. Now that you have demonstrated rerunning searches, I understand how to do it, but I don't think it is obvious. In the old system, you had a rerun option. Could it not appear as a drop-down option? Yes, good observation. We have been engaging with our product management team to discuss some of the functionality, so we can take that on board. There are some changes taking place to enhance this experience as well. So again, some things are coming. Again, I'll probably refer you to the document that I shared previously as well, which will be updated with new developments as well. There are ways to save search sets and rerun them, etc., which is being reviewed at the moment. Okay, so again, appreciate that. So yeah, I mean, so you can rerun the search, but typically what you do, you're rerunning the last set. Okay, so again, you will want to see more than just the last final set, right? So yeah. So I think that there is more functionality coming. So again, what we're showing you is what's available now. It's live, it's working. So we already have access to this platform. So it's there, but there's more to come as well. And as you'd expect with software in general, I mean, we're all used to updates to our mobile phones. We don't even know what they are necessarily. We also have to install them, etc. And the platforms change, etc. and progress. So again, it will be the same with EBSCOhost, but there's more to come. Okay, I think we have some more comments coming through as well. So while I'm waiting for those, I just want to mention the alerts feature too. So one thing, of course, to note with the search that you're running, you may want to review future results as well, and you may not have time to, re-enter this data in, as it were. So we have the alerts feature, and what you can do here is with the tools menu, you may have caught a glimpse of this. You have under Save Search, Create Alert. And this just simply allows you to create an email notification, essentially, of this search rerunning periodically to give you results. And obviously, a number of those results will be new articles, items, etc. So again, you can give it a name: adult cancer patients. Okay, and meditation. Again, there's a description for any comments you want to add. The frequency by default is daily, but you may want it only weekly or monthly. You can see when it's created, it will expire in 1 year, so it will run for up to 1 year automatically. You see the query there, the total query, the combined query, and then you can create the alert here. Now, as you see, the alerts is available within my dashboard. So if you could close this, you'll see again the link to alerts under my dashboard on the left, on my left, and then you'll see the search alerts tab. Okay, so again, you can see this is on this topic, this subject. It's weekly, a weekly alert. It's created on this day, on the 12th, on the 9th of December at 11:11, and we have 2 filters applied to it so far. You can go in the tools menu to edit the alert. So, for example, if you then decide weekly is too frequent, monthly sufficient for this particular review, as it were, and if it's coming to an end, then you can actually extend or renew the alert as well. You give that option and then save changes. Okay, so that may be in support of a particular person, department, as it were, in relation to this context, or it may be just for your own benefit to see what new items are coming out rather than to rerun the search yourself. So again, whether you set this up yourself or if you advise someone how to do this, then there's the need to maintain that. So again, under tools, you can edit the alert, you can view results, or you can simply delete it from here if you no longer require that, or you finish that particular project, as it were, and it's no longer required. Okay, so again, you can delete that from this menu here. Claire has asked a very good question. When will the platform be stable? We're told there's more to come. However, some researchers are concerned that changes are still happening months after it was supposed to be stable. Some are still reporting low numbers compared to what they had in the previous version. Okay. Yeah, I mean, there is a timeline. There are timescales for the introduction of features of enhancements. Again, I'll show you the page where it details that. The export file, Okay, so the export file, so I'm just trying to understand the question. The export file takes a while. I guess that takes a while to arrive in your email inbox. We get reports for a few minutes to a few hours. Okay, yeah, that's the kind of thing that we need to be aware of or be notified of. So you can notify us, your local EBSCO account representative, or you can send an email. In fact, I'll put it in the Teams chat. So the default email for any technical support inquiries is so for service issues, please email support@ebsco.com. So just put that in the Teams chat. So that's the standard email really for reporting any issues that you're experiencing. If you work or affiliated with the NHS, there is the NHS in England, the service desk that takes or collates queries, and they will escalate to EBSCO. But I don't think we have anyone from the NHS on this session today. But so basically, you can use the support email there, or go to EBSCO Connect, and I'll just mention EBSCO Connect in a moment, because you can sign in with EBSCO Connect and you can set up an account so that you can have you can report cases there. So some issues will be technical issues that need to be looked at, reviewed. There may be known issues. Some things may be just enhancements. Okay, so what I'll do at this stage, I think I'll cover most of the functionality I plan to. I'll just go back to the PowerPoint and just highlight a few things here. So I'll answer that question. I'll get to that question in a moment. So let me just go back on screen. Okay, and I'll just refer to another question or comment that's just come up as well once that's loaded. So we've just had the live demonstration. So just referring to a comment here, organizing the project contents. For example, is there a way I can add reasons for deleting items or record how many records there were originally and then deleted? These things will be useful. I think I'm asking for project history. Okay, yeah, so there is no project history. It's a good point, though. I think what you need to do in that case, if you want to know, so if for example, you save the search in the project folder, you have your save records, and you delete some, you could note those details in the description field. So I think that's something you'd have to do manually. You have to make comments, details what you've done. So if you've saved the initial search, you've saved the results, and then you process them through the project, then you delete some individually. So if I go back briefly to the screen just to highlight that again, so if I just share my screen to highlight that. So we're back in the projects folder, and then so if I go to this one, for example, and I'm going to review these records. So again, I deleted 2. In fact, actually you can't do that, I don't think. Yeah, actually you can edit project here. You'd do that here. Okay, so you would carry out some of those deletions, whatever it might be here, amendments, etc. If you want to amend the search, you can edit the search details here, and then you'd need to make sure that you note that in the project folder itself here. So for example, deleted 2 records on whatever it might be. So it's today, isn't it? So it's still the 9th, the 12th. And I can explain why I did that. So you can add comments, even as a prompt for yourself, even just to remind you what you did or didn't do there. But there is no project history as such. But again, we can highlight that. We can record that as a potential enhancement. The way it works, basically, your comments will take on board. I will forward them to a support team, etc., product management, and basically create a case on that. And if enough are saying the same thing, then it may be priority. Right. So again, some things will be priority. Some things will have to be on the back burner, as they say, because of the amount of work that needs to be done. So it depends on the popularity of certain requests and so on. Again, we'd like to know, though, what would be useful. Okay. What I will do, I did mention EBSCO Connect, and I'll remind you in a moment of that. So let me just stop sharing my screen, and I'll go back to the PowerPoint again. So it's good to have this feedback, these comments. We need to have that. Okay. Before I go to EBSCO Connect, okay. Yeah, good question. Claire, when will everyone be on the same interface? We have some researchers using both. Again, it's coming. Obviously, the plan is that the Classic will be gone, will be decommissioned, and this will be the platform, the default platform going forward. So it's taken time to get to that stage because obviously enhancements, improvements to the service as well. So again, yeah, there's some timeline changes. Okay, that's what I can say. Okay, so just to take home points in relation to this particular topic, obviously you can save, download, and share results using the respective tools. That's currently possible with the new interface, with the features that I've shown you today. You can save and download searches for future access and reporting. So the advanced search results page displays the search history. Now, if some of you are not seeing that, by the way, that has not been switched on by default. So that is something which needs to be enabled for yourselves by our EBSCO account team. Okay, so again, what you've seen today, I have it enabled, implemented for my demonstration. It is there, it is available, but it needs to be activated. It needs to be enabled in EBSCO Experience Manager, which is the newer admin tool that is used to customize the interface. Okay, so again, that's something which is possible. Exporting individual records or up to 25,000 records on the result list. We've seen that you can do that. Again, requires a MyEBSCO sign-in for this. You can create projects and add searches and results. We've seen that also. Again, that is dependent on signing in with the MyEBSCO account that you can create online as you're using it. And also we have the online hub, or you can visit EBSCO Connect for more support information. And I'm just going to go there now. So again, training support material, I have included some key links there just to remind you of some of the functionality. Again, especially when you're looking at saving searches, creating projects, and using the dashboard in the new interface. So this information is current. Obviously, we do update the content when changes take place. I know that can be frustrating with the amount of changes taking place, but there are enhancements that are in process, etc. Okay, so EBSCO Connect is the main support portal that you go to for information. So whether you're looking at tutorials, help sheets, guides, etc., and also upcoming developments as well. So that's connect.ebsco.com. And with that, if you sign in as a user, and you'll need to request an account for this. So if you click sign in on the top right there that you see on the screenshot, in fact, what I might do is I'll go there. In fact, let me go there from the interface. So let me just click out here. So I'll go from the interface. I'll go back to my screen. So I'm on the live desktop again. So on the left-hand column, you've got under Research Tools, New Search, and Help here. So Help here, as you would recall from the previous session, takes you to the Quick Start Guide here. Okay, so you'll find more information that's available on this page. Okay, so again, if you're looking at using the dashboard, there's a query or creating projects, you can go directly to the page related to creating projects, etc. Like you see as it stands currently. Now, also, if I click back to home, you'll see the sign-in option here on the top right. This will allow you to request an account. Okay, so if you need an account, you can request one from this page, and you have to have age verification as well. So I won't enter my date of birth. It's actually come up very soon, but you would submit that and go through the process. So once you can sign in, and if I click sign in here, the point is, I'm trying to show you here, is when you sign in, it will also open up a case management system as well. So you can report cases, you can submit requests, queries to the support team directly. So you can use the Euro support email, which I put in the Teams chat, but you may get a quicker response using the case management system. It will log your request. It could be an enhancement. It could be a technical issue. And then you can track that as progress is made with it. The advantage of this also means that if you have colleagues, I know we have a number from the same institution here, same university, if you and your colleagues each sign up for an EBSCO Connect account, then they'll be linked together for your organization, for your institution. So that means if one person submits a case and goes on leave, then someone else can check the progress with that, etc. Okay, so I've got a few more comments here. Why are the enhancements not automatically switched on by EBSCO, such as the new search history? Okay, I think that's just a kind of executive decision based on feedback from customers that sometimes in the past we've switched features on that were not required or wanted. And so we were kind of seen to be dictating what you should see. So again, it's down to the choice of the account, of the customer, as it were, yourselves as librarians, what will work best. That's my understanding. I'm not party to those discussions, but that's my understanding. It may be that with this kind of forum feedback, then they might decide actually we realize most people want to see that. So again, it's a decision that's been made at head office, presumably to say you have the choice for that feature, that functionality. Okay. Yeah, but I can feed that back too, that, again, I know within the community that we're, with the attendees today, especially from the academic sector, this is most likely to be required. The same, I work with medical librarians in the NHS. Again, they're in the same situation. Generally speaking, they would want to see the search history displayed by default. So again, we can feed that back. And in the export options in EM, so let me just, we've got 5 minutes. So, Nicola, thanks for that question. I will find this and send it to you. In fact, I'm still sharing my screen. So what I'll do, let me just do that now. Let's see. So rather than you staring at the screen, I'm just going to stop sharing here. I'll go back to my PowerPoint, but then I'll post the link to the Experience Manager configuration. So I'm just going to see if I can find this up on screen. So okay. Do you want to also do in a minute? I'll bring this up too. So I've got this one. I'm going to go in and see if I can find the link straight away to this. Yeah, sorry, I'm just looking for the actual document that will tell you, and I can put that in the Teams chat. Okay, yeah, just found it. Okay, so I'm going to click In fact, this is so if you do have access to EBSCO Experience Manager, so that's the tool where you manage the interface alongside EBSCO Admin, and we are running sessions on both. But the link I just posted is the setting for enabling the search history to be displayed from the advanced search page. Okay, so again, you can refer to that, which means you can do it yourself if you've got admin rights to EBSCO Experience Manager. Again, if you want to liaise with your EBSCO account team or contact me later, then you can do so. Okay, so that link there refers to the settings in EBSCO Experience Manager that need to be enabled for you to see the search history displayed as you saw it today. Okay, so I will also just jump back because I found the other page I wanted to show you as well. I think I showed you earlier, but for those who didn't see it, in fact, let me post that in the Teams chat as well. It's probably easier to do that because we want to run over time. But I'm also posting the updated page. So it's updated on the 3rd of December. So for the new EBSCO user interface updates for advanced search and systematic reviews. So that's specifically intended to highlight what has been released and what is coming soon in support of systematic reviews when using the EBSCO interface. Okay, so again, there's some things you might get answers to in that document. We do have the EBSCO roadmap as well, which also details the enhancements for this interface. And I think I might do that, also add that here as well. So I wasn't intending to go through all that documentation, but I'll put that link there as well. So the roadmap also gives you upcoming enhancements to the interface and also the time scale for those. Okay. So just finally then, we have the EBSCO Healthcare Training Resource Portal, which is on our Stack system, and that will give you links to information, upcoming training sessions alongside recordings or webinars, which are on the EBSCO UK YouTube channel, which is mentioned at the beginning in the slide, and also other handout support materials as well through the support information area on this page as well. Okay, so I know we're almost at the hour mark. We started a little late, but I will stop here. You can contact me directly, of course, at iquicks@ebsco.com. And I appreciate that there are obviously there are changes that are impacting yourselves. Again, I can feed that back to our teams. But what we wanted to just show you now is initially what is currently possible within the interface. Again, we will, in the new year, we'll be running more of these sessions. In fact, I've got another one of these sessions coming up in a couple of weeks before we finish. I think it's next week, and highlight obviously any changes that have taken place and are taking place. So I will collate the responses or the comments, questions that have come through, and I'll look at them in more detail again, and probably will feedback via the email too in relation to some of those as appropriate. So it's now 11:30 local time here in the UK. So I'm happy to finish here if you are. Okay.